Traditional Chinese medicine has been used for centuries to address women's health issues using herbal remedies. Modern clinical research is beginning to support many of these traditional practices. Below, we explore 8 of the most common obstetric gynecological conditions that women seek treatment for, focusing on how Chinese herbal medicine can help. For each condition, we'll bridge TCM theory, qi, blood, liver, kidney, with Western medical understanding, explain how specific herbs work in the body, and highlight research on their efficacy. 1. Menstrual disorders. Irregular periods, cramps, heavy bleeding. Western perspective. Menstrual disorders include irregular menstrual cycles, painful periods called dysmenorrhea, very heavy bleeding called menorrhagia, or absent periods called amenorrhea. Causes range from hormonal imbalances, like excess prostaglandins causing cramps, or estrogen-progesterone irregularities causing cycle changes, to stress or conditions like polycystic ovary syndrome. Conventional treatments often involve NSAIDs for pain or hormonal contraceptives to regulate cycles, which can carry side effects. TCM perspective. In TCM, a healthy menstrual cycle depends on harmonious flow of qi, energy, and blood in the uterus, governed by the liver, spleen, and kidney organ systems. Common TCM diagnoses for menstrual problems include liver qi stagnation, stress or emotional tension causing cramps and PMS, blood stasis, poor blood circulation leading to clots and severe pain, cold in the uterus causing painful cramps and scant flow, or qi blood deficiency, weakness leading to irregular or light periods. The treatment principle is to regulate and invigorate qi and blood, warm the uterus if needed, and restore balance. Chinese herbal formulas are tailored to the woman's pattern. For example, if cramps are due to blood stasis and cold, a classic formula like Xiao Fu Ju Yu Tang may be used to relieve pain. If the issue is irregular timing from qi stagnation, formulas such as Xiao Yao San containing bupleurum to soothe liver qi and white peony to nourish blood are common. A fundamental women's formula is Si Wu Tang, 4 substances decoction, which contains dong quai, known as female ginseng, along with peony, rehmannia, and ligusticum. Dong quai, in particular, is famed for tonifying the female reproductive system and relieving menstrual pain by improving blood circulation. These herbs supply nutrients to rebuild blood and also promote smooth blood flow to prevent cramps. Dong quai and ligusticum often appear together in formulas to treat menstrual pain. Pharmacological studies show ligustilide can relax uterine muscles and improve blood flow. By combining blood-nourishing and blood-moving herbs, TCM formulas both alleviate pain and address its root cause. Modern clinical studies support the use of Chinese herbs for menstrual disorders. A 2020 systematic review of Si Wu Tang for primary dysmenorrhea found significant pain relief compared to NSAIDs or conventional therapy. The trials showed favorable effects and suggested it may be safer than conventional medicines with fewer side effects reported. Another review noted that Shuefu Juyu Tang was effective in reducing menstrual pain intensity with higher efficacy than placebo or NSAIDs. These findings align with patients' experiences that herbal medicine can regulate cycle timing, reduce heavy bleeding, and ease cramps without hormonal effects. Overall, Chinese herbal therapy offers a holistic approach to menstrual health by addressing circulation and hormonal regulation. Premenstrual syndrome refers to physical and emotional symptoms occurring 1 or 2 weeks before menstruation due to cyclical hormonal changes. Symptoms include mood swings, irritability, depression, bloating, breast tenderness, and fatigue. Conventional approaches may use antidepressants or hormonal contraceptives. In Chinese medicine, PMS is often a sign of liver qi stagnation. Essentially, the liver's energy becomes stuck in the lead-up to the period. This stagnation can lead to mood disturbances, breast distension, and irritability. Sometimes underlying spleen deficiency or kidney yin deficiency can contribute as well. The TCM strategy is to soothe the liver, relieve stagnation, and nourish the blood and yin. The go-to formula for liver qi stagnation is Xiao Yao San, which is widely used for PMS-related stress, mood swings, and breast tenderness. It contains bupleurum, dong quai, white peony, atractylodes, poria, and licorice. This formula spreads liver qi and nourishes blood-modified versions, such as Jiawei Xiao Yao San, are used for more irritability. Other calming herbs include chai hu, He Huan Pai, and Suan Zhao Ren. By addressing the mind-body connection, these herbs can reduce emotional volatility. There is promising evidence that herbal medicine can significantly mitigate PMS symptoms. A systematic review found 50% or greater reduction in overall PMS symptoms. Women receiving herbal formulas reported substantial improvements in mood stability. Another trial showed superior relief of PMS mood symptoms and was well tolerated. Some components of TCM herbs have known effects on the nervous and endocrine systems. Buplurum and peppermint help ease tension and stress-related gut symptoms. Research has shown that Xiaoyao San may work by regulating the HPA axis. Chinese herbal therapy for PMS helps take the edge off by calming the mind. Infertility is defined as inability to conceive after 12+ months. Causes include ovulatory disorders, tubal blockages, endometriosis, uterine fibroids. Conventional treatment ranges from ovulation-inducing drugs to IVF. There is growing interest in integrative approaches to boost fertility naturally. Chinese medicine views fertility as a reflection of the underlying vitality of the kidney system, which governs growth, development, and reproduction, as well as the health of the liver, which regulates blood supply to the uterus, and spleen, which provides nourishment. Common TCM patterns leading to infertility include kidney yang deficiency, kidney yin, or blood deficiency, and qi and blood stasis. TCM treatment for infertility is highly individualized. The goal is to restore balance and strengthen the body so conception can occur naturally. For women with deficiencies, formulas such as Ba-Zhen Tang combine the 4 substances for blood with 4 gentlemen for qi. This formula contains angelica, romania, peony, ligusticum, plus ginseng, atractylodes, poria, and licorice. If a patient has cold and yang deficiency, warm kidney yang herbs such as cinnamon bark or epimedium may be added. For those with polycystic ovaries, herbs to resolve phlegm dampness are included to promote ovulation. The ultimate aim is to regulate the menstrual cycle, enhance ovulation, and improve egg quality, balancing yin and yang. A landmark meta-analysis of 40 randomized trials involving over 4,200 women found significantly higher pregnancy rates with herbal therapy. Women receiving Chinese herbal therapy had 60% conception rates compared to 33% with Western fertility drugs or IVF. Herbal therapy enhanced key physiological indicators. Ovulation frequency increased, basal body temperature charts normalized, cervical mucus scores improved, and uterine lining thickness became more optimal for implantation. The herbs likely exert multi-targeted effects. Some contain phytoestrogens that regulate hormones, others improve blood flow and have anti-inflammatory effects. Modern integrative fertility clinics often use these herbal strategies alongside Western treatment to improve outcomes. PCOS is one of the most common hormonal disorders in women of reproductive age. It's characterized by irregular periods, androgen excess, and insulin resistance. Conventional management includes lifestyle changes and medications. In Chinese medicine, PCOS would not have an exact ancient name, but it is understood through patterns. A very common pattern is phlegm dampness and blood stasis with kidney deficiency. This describes the hallmark ovarian cysts and obesity as a form of phlegm damp accumulation. Treatment focuses on dissolving phlegm, moving blood, and tonifying the kidney spleen to stimulate regular ovulation and hormone balance. A classical herbal approach to PCOS is to transform phlegm and invigorate blood while supporting the kidney. One famous formula used in practice is Kung Fu Dao Tan Wan, which addresses phlegm damp in the uterus ovaries. To this, practitioners often add blood-invigorating herbs like Dan Shen, salvia, or Tao Ren, peach kernel. Additionally, tonics like Dangui and Shudi Huang, Remania, nourish. Blood and yin. A very interesting inclusion is Giji, cinnamon bark. Cinnamon is warm and improves circulation. Modern studies show that Chinese herbal medicine can address both the reproductive and metabolic aspects of PCOS. An overview of 18 systematic reviews found that all of them reported improvements in PCOS symptoms. These improvements include more regular menstrual cycles, higher ovulation rates, reduction in ovarian cyst size, count. On the metabolic side, herbal remedies can also tackle insulin resistance, a key underlying issue in PCOS. For example, a 2024 meta-analysis examined the effect of cinnamon on women with PCOS. In clinical practice, Women with PCOS who undertake a course of Chinese herbal medicine often report their cycles becoming more regular. One trial even noted that an herbal formula combined with clomiphene led to better ovulation and pregnancy rates. The holistic nature of the herbal treatment makes it a comprehensive approach to PCOS. Uterine fibroids are benign tumors of the uterine muscle, affecting up to 70% of women by menopause. Fibroids can cause heavy menstrual bleeding, pelvic pressure, pain during periods or intercourse. Western treatment ranges from medications to control hormones to non-invasive procedures and surgeries. TCM perspective. In Chinese medicine, fibroids are categorized under zhengjia, meaning abdominal masses, or blood stagnation conditions. Fibroids are seen as congealed blood, and often phlegm, in the uterus forming a mass. This stagnation can result from chronic qi stagnation, often related to stress or liver imbalance, cold accumulation, slowing circulation, or deficiencies that fail to keep the blood moving. The guiding treatment principles are to invigorate blood, dissolve stasis, and soften masses, while also addressing underlying imbalances. For example, strengthening spleen to resolve phlegm, or tonifying kidney qi if overall vitality is low. Essentially, TCM aims to shrink the fibroid and alleviate symptoms by improving uterine circulation and hormonal harmony. Herbal treatments. A classic formula for uterine fibroids is Guiji Fuling 1, cinnamon twig and poria pill. This 500-year-old formula was designed specifically to quicken the blood and dissolve abdominal masses. It contains Guiji, cinnamon twig, to warm and stimulate circulation in the uterus, Fuling, poria mushroom, to drain dampness, treating the phlegm aspect and swelling, Tao Ren, peach kernel, and Mudan Pai, Mutan peony root bark, to break up blood stasis, and Qi Shao, red peony, to move blood and reduce pain. Modern herbalists might add Sanleng and Iju, two potent rhizomes, which are known for their ability to break up accumulations. These have demonstrated anti-tumor effects in lab studies, suggesting they may help inhibit fibroid tissue growth. Another useful herb is Yi Mu Kao, Leonurus motherwort, which improves uterine blood flow and has a gentle uterine contracting effect. It earned the name Benefit Mother Herb for its usefulness in regulating menstruation and postpartum recovery, and it can help reduce bleeding and clotting associated with fibroids. By combining these herbs, the formula works to gradually shrink the fibroid mass, from a TCM view, dispersing the stasis and phlegm that form the mass, and relieve the associated symptoms like pain and excessive bleeding. Efficacy and research. Scientific studies from China and the West have investigated herbal treatments for fibroids. Compelling evidence comes from trials combining Chinese herbs with Western medicine. A review of 38 randomized trials found that Guiji Fuling formula plus mifepristone was more effective than mifepristone alone. Women who received combined herbal therapy had greater shrinkage in fibroid volume and more symptom relief. The herbal formula improved menstrual pain even when used alone, with no serious adverse effects reported. Researchers have explored how these herbs work at the cellular level. Studies show the formula can inhibit tumor growth, reduce blood vessel formation, and lower inflammation. This corresponds exactly to TCM actions of invigorating blood and resolving masses. Laboratory studies show the formula induced programmed cell death in fibroid cells. The herbs work in multiple ways: anti-estrogenic effects, improved blood flow, and pain relief. Women using Chinese herbal medicine often report lighter periods and less pelvic pressure. While large fibroids may not disappear completely, their growth can be stabilized and surgery postponed. A Cochrane review noted herbal preparations showed promise with high patient satisfaction and fewer side effects. TCM herbal therapy addresses fibroids by improving circulation and alleviating symptoms. 1. Endometriosis. Endometriosis is a condition where uterine lining tissue grows outside the uterus. It affects up to 1 in 10 women of reproductive age and causes chronic pelvic pain. The displaced tissue bleeds and causes inflammation each cycle, leading to scar tissue. Western treatments include hormonal therapies, pain relievers, and laparoscopic surgery. These treatments often have significant side effects or the disease can recur. Many patients turn to complementary therapies for relief. In TCM, endometriosis falls under dysmenorrhea and abdominal masses due to blood stasis. It's viewed as blood stasis with qi stagnation, compounded by cold or heat inflammation. The ectopic tissue and ovarian cysts are considered stagnant blood the body failed to eliminate. TCM recognizes underlying kidney deficiency or spleen dysfunction as contributing factors. Treatment focuses on invigorating blood, breaking up masses, and regulating the cycle. Warming herbs are added for cold signs, cooling herbs for inflammatory pain. The approach is holistic, relieve symptoms, and correct the underlying terrain. Many endometriosis formulas are modified versions of blood stasis treatments. Giji Fuling 1 is frequently used to reduce lesions and ease menstrual pain. Sanleng and Iju powder are paired to break up severe blood stasis. Wen Jingtang warms the uterus and nourishes blood for women with cold signs. It includes Wuju Yu and Gui Zhe to warm, plus Dang Gui and Chuan Xiong to move blood. For high inflammation, Qingre Tiao Shui Tang uses cooling herbs like red peony and mutan. Yanhu Suo, called herbal ibuprofen, is often added for endometriosis pain. These combinations aim to shrink lesions, prevent adhesions, and alleviate pain. Efficacy and research. Growing evidence supports the role of Chinese herbal medicine in managing endometriosis, especially for pain relief and fertility improvement. A comprehensive 2023 meta-analysis of 34 studies with 3,389 participants concluded that herbal medicine, used alone or alongside conventional treatment, can significantly reduce endometriosis. Related pain including menstrual pain, pelvic pain, and pain during intercourse, and does so with fewer side effects compared to hormone therapy. Women treated with herbs had reductions in pain scores similar to those on pharmaceutical therapies, but reported lower rates of hot flashes, mood swings, or irregular bleeding, common side effects of hormonal drugs. Furthermore, when herbal therapy was combined with conventional hormonal therapy, the combination yielded better pain relief than hormones alone, suggesting a synergistic effect. Beyond pain control, TCM may improve the fertility aspect of endometriosis. Endometriosis can cause infertility by distorting pelvic anatomy and affecting egg quality or implantation. Some studies have found that women who received TCM herbal treatments had higher pregnancy rates and lower miscarriage rates in endometriosis-related infertility compared to controls. One meta-analysis reported that adding Chinese herbal therapy to the treatment plan led to improved pregnancy outcomes and a reduced probability of recurrence of endometriosis after treatment. This is significant because recurrence is a major problem in endometriosis management. TCM's whole system approach addressing the root imbalance may help stabilize the condition long-term. In practical terms, patients with endometriosis who use Chinese herbs often note that their menstrual pain gradually lessens in intensity, cycle flow becomes more regular, and their digestive function or energy, often compromised in endo, improves, all contributing to a better quality of life. Scientific research has also isolated some compounds from TCM herbs like curcumin from turmeric or berberine from coptis that have anti-inflammatory and anti-angiogenic effects relevant to endometriosis. These might inhibit the abnormal tissue growth and reduce the inflammatory cytokines that cause pain. In summary, Chinese herbal medicine offers a multi-pronged, gentler approach to endometriosis, easing pain, modulating hormones and immunity, and improving fertility with a lower side effect burden. It can be used on its own or as a complementary therapy alongside laparoscopic surgery or hormonal treatments to enhance overall outcomes.